Good morning. Just a few words about medications for intracranial regulation. Sorry you have to look at me. I really didn't mean for that to be there, but I don't know how to get it off. So let's just go on with this. Let's talk about mannitol first. Mannitol is an osmotic diuretic, and we call mannitol Lasix for the brain. It's primarily used to reduce that intracranial pressure, and the way it does it is it draws water out of the brain tissue into the bloodstream. So it works by increasing the plasma osmolality. Okay, so that means there's a gradient. And remember, water follows salt. So when the salt level or the sodium level inside the vessels is higher, then it pulls that water out of the brain tissue and into the vessels. Okay, and this helps to decrease that cerebral edema. So we use this a lot in traumatic brain injuries and anytime patients have really severe cerebral edema. When you're giving mannitol, it's really important to monitor their serum electrolytes and their osmolality closely, because it can lead to electrolyte imbalance and even dehydration and renal strain as well. So always inspect mannitol for crystallization before you use it, okay? But if it does have crystals in it, of course you will not administer it. Nursing considerations are going to be to monitor blood pressure. You need to make sure their intake and output is monitored closely. Their serum osmolality, again, needs to be checked, and you need to assess for signs of dehydration. So mannitol is contraindicated in patients with active intracranial bleeding. So this is not for your stroke patients, okay? These are for traumatic brain injury patients. And anybody that's already dehydrated or has certain kidney issues, you wouldn't want to use mannitol for them. Dexamethasone is our next drug, and it's a potent corticosteroid, and it helps with intracranial regulation by reducing inflammation around usually brain lesions, which helps decrease cerebral edema and intracranial pressure. So this is really valuable when we're trying to manage brain tumors, but anytime there's swelling in the brain, it will help to give dexamethasone, especially when you think that swelling is impacting the intracranial pressure. Because remember, if the pressure gets too high in that brain, that's all. Your skull doesn't move. So if the pressure inside gets too high, it's going to damage the brain more by pushing that brain tissue against that hard skull and crushing it. Okay. Dexamethasone helps stabilize the blood-brain barrier, decreasing inflammatory cytokines that can get into the brain. So this effect reduces pressure in the skull. It relieves symptoms like headache, nausea, and neurological deficits. So key nursing responsibilities when you give dexamethasone, you need to monitor their blood glucose, because remember, steroids can make that blood glucose high. Watch for signs of infection, because corticosteroids can suppress the immune system. Need to make sure you're assessing for gastrointestinal symptoms, because GI bleeding can happen with this medication as well. And don't forget, it's essential to taper the drug appropriately if it's been used for more than just a short duration, because abrupt discontinuation can lead to adrenal insufficiency, and then you've just stacked on more problems for the patient. Anti-epileptic medications are really essential in managing seizure activity, which is common in patients with intracranial conditions like traumatic brain injury, stroke, or even tumors. It's common for them to have a seizure. So a lot of times they will receive anti-epileptic meds if they have a traumatic brain injury or something like that, just to prevent them from having a seizure. Each anti-epileptic has unique properties and side effects. So let's go over them just a little bit here. Phenytoin or Dilantin is a sodium channel blocker. it stables those neuronal or neuron membranes to help prevent seizures. So you've got to remember that it has a narrow therapeutic range, so therapeutic drug monitoring is really going to be necessary for dilantin. Your key side effects are going to be gingival hyperplasia, okay? Potential toxicity, because remember we've got a really narrow threshold, and that's about it for that one that I can think of. The next one is Keppra. That's the simple word, and I'm not going to try to pronounce the other one. Keppra. It's another commonly used anticonvulsant because it has more favorable side effects than dilantin. So it's typically better tolerated, and it doesn't really require any regular blood level monitoring. So you don't have to check and keep it in therapeutic range like you do with phenytoin. So you need to watch for side effects like dizziness and fatigue, and educate the patients about any mood changes. It can occasionally cause mood alterations. Now, valproic acid or Depakote increases GABA levels. And remember, GABA is that chill neurotransmitter that decreases neuronal excitability. We have to monitor liver functions with Depakote and blood levels, as this drug can be hepatotoxic, so toxic to the liver. So if your patient is receiving this medication, you need to educate them about signs of liver issues such as dark urine or jaundice, and monitor for therapeutic effects, of course, side effects. Check liver and renal function periodically on the specific anti-epileptic used.